We'll get started. So hello everyone. My name is Marvell Adams Jr. I am CEO of the Caregiver Action Network based here in Washington, D.C. And welcome to today's webinar entitled An Introduction to Risk Less, Do More. My guest today is Kari Benson. Kari is the Deputy Assistant Secretary for Aging for the Administration for Community Living. She's here today to discuss the U.S. Department of Health and Human Services Risk Less, Do More campaign, which is designed to increase awareness of, confidence in, and uptake of flu, COVID-19, and RSV vaccines for individuals all ages, including, of course, older Americans. Ensuring that older Americans in our care receive appropriate immunizations is always incredibly important, but especially now during respiratory virus season. As the immune system undergoes changes with age, coupled with the prevalence of chronic conditions among this population, older adults become more susceptible to various infectious diseases. Immunizations are pivotal in reducing the risk of infections, their associated morbidities, and potential outbreaks in communal living environments. So before I fully introduce Kari, I'd like to tell you a little bit about Caregiver Action Network. Our organization supports and serves family caregivers, sometimes called informal caregivers, but in almost all cases, unfortunately, unpaid caregivers. We support them with resources, education, outreach, and advocacy, and we do that through a whole host of services. One of the things that we're highly involved with right now and leading is the National Family Caregivers Month campaign. Our theme this year is I Care, and you can find out more information on Caregiver Action Network and the NFC campaign for this year at caregiveraction.org. So now let me turn to our guest, Kari Benson. As I mentioned, Kari Benson is the Deputy Assistant Secretary of Aging at the Administration for Community Living. In her role, Kari leads the Administration on Aging and advocating on behalf of older Americans. In this capacity, she guides and promotes the development of home and community-based long-term care programs, policies, and services designed to afford older people and their caregivers the ability to age with dignity and independence, and to have a broad array of options available for an enhanced quality of life. This includes the promotion and implementation of evidence-based prevention interventions proven effective in avoiding or delaying the onset of chronic disease and illness. Kari's entire career has been in the Aging Network, most recently serving as the Director of the Aging and Adult Services Division of the Minnesota Department of Health Services Division of the Minnesota Department of Human Services, and as the Executive Director of the Minnesota Board of Aging. Kari holds a bachelor's degree in human ecology from the University of Wisconsin at Madison, and a master's degree in public policy from the Humphrey Institute of Public Affairs at the University of Minnesota. Kari, welcome.
Thank you, Marvell. It's a pleasure to be here.
Yeah, it's really great to have you here. I'll have to say, just in full disclosure, I'm formerly a nursing home administrator, and so understanding the need for vaccinations as someone that grew up in the rural South and the Black community, vaccinations were not the most trusted thing, and so we're going to talk about that a little bit further down. But once I became a nursing administrator, I have to say I understood full well the importance of vaccination. So that leads me to my first question. What is this new awareness and education campaign called Risk Less, Do More?
Sure, Marvell, the U.S. Department of Health and Human Services launched Risk Less, Do More to inform people about the risks of respiratory viruses and to empower them to protect themselves from flu, COVID-19, and RSV. Risk Less, Do More was launched during National Immunization Awareness Month in August, before the release of the 2024 to 2025 flu and COVID-19 vaccines, and it will run through the winter of 2025. The campaign offers helpful resources for healthcare providers to support flu, COVID-19, and RSV patient education. These include materials that focus on older adults, along with materials created for populations that often have lower access to healthcare, such as Black and Latino communities and people living in rural areas. The campaign is an important component of a many-pronged effort to reach the people at increased risk. And of course, we know older adults and people with disabilities, particularly those who live in nursing homes, as you mentioned, Marvell, and other facilities, have the greatest risk of serious illness or death from these viruses. So making sure people understand the risks and have the information needed to make decisions, making it easier for them to get vaccinated, has been a key focus for the Administration for Community Living. In 2022, we launched an initiative that complements the Risk Less, Do More campaign. We awarded grants to U.S. Aging and NCOA to rapidly increase access for older adults and people with disabilities to the updated COVID-19 vaccine and annual flu vaccines. The program prioritizes reaching older adults and people with disabilities who have been historically underserved and faced additional barriers to accessing vaccines, including but not limited to those who are from communities of color, LGBTQ+, Native American, and or at risk of institutionalization, people of low income and or limited English proficiency, and or live in rural areas, and homeless individuals. So U.S. Aging and NCOA, they quickly distributed this funding and leveraged partnerships across the aging and disability networks. And we had much success in that effort. The vaccine uptake initiative included 485 of our regional and local partners, over 1,600 satellite locations across the country, and over 25 national aging and disability organizations participated. So, as a part of this effort, we also leveraged our two national hotlines, the Elder Care Locator and the Disability Information and Access Line that we call DIAL, that have been helping people with disabilities and older adults find accessible vaccine sites, obtain in home vaccination, or find transportation or other support that they may need to get a vaccine. So folks can learn more about DIAL and the Elder Care Locator on our webpage, acl.gov/help.
Great. Wow. Thank you for that great information, Carrie. So we mentioned already that, there are certain groups that are perhaps at more higher risk than others, but also really wanted to hone in on, are there particular groups of people that are at higher risk for severe illness related to flu, COVID-19, and RSV, like adults living in long-term care facilities?
Yes, absolutely. Most deaths from flu, COVID-19, and RSV are in people older than age 65, and that risk does grow with age. So, as we grow older, our immune systems do not work as well, and older adults are more likely to have health conditions that make them more likely to get sick. As many as 8 out of 10 flu deaths are of adults age 65 or older. Compared to adults under age 40, people over age 75 are about 9 times as likely to die from COVID-19. RSV is a common virus that usually causes mild cold like symptoms, but it can also be severe and even deadly in older people. So every older adult really should get this season's flu and COVID vaccines. High dose flu vaccines that cause a stronger immune reaction are available for extra protection for adults age 65 and older. All adults age 75 and older, and those 60 and older with certain health conditions or who live in a nursing home should get an RSV vaccine. If you help care for a family member or friend age 60 or older, make sure they know about their risk for getting very sick with flu, COVID-19, and RSV, and that vaccines can help protect them. Some racial and ethnic groups, including Black and Hispanic people in the United States, are at higher risk of severe illness from flu, COVID-19, and RSV. Black and Brown communities bore some of the heaviest impacts from the COVID-19 pandemic. Black adults are more likely than white and Hispanic adults to be hospitalized for flu, COVID-19, or RSV at the peak of the 2023 to 2024 respiratory virus season. And Hispanic adults are more likely than non-Hispanic white adults to be hospitalized for flu by the end of the 2023 to 2024 respiratory virus season.
All right. Wow. Thank you. So, just going on that thread a little bit more, understanding that particular groups of people are at higher risk for serious illness, as you just laid out, a two-part question. Why is it important for caregivers to be vaccinated as well? And also understanding that the persistent challenges with trust in vaccinations in some communities. Can you talk about the idea of trusted messengers and how that might help address racial disparities in vaccination rates?
Absolutely. We know that trusted messengers are an incredibly important part of this puzzle, and we need to really rely on trusted messengers to share credible sources of information or be credible sources of information. And who those people are vary from community to community. The Risk Less, Do More campaign is working with doctors, nurses, pharmacists, and community organizations that engage at risk populations. That includes the aging and disability networks, who are unmatched when it comes to reaching older adults and people with disabilities. We know from both research and experience that this approach works. The HHS We Can Do This COVID-19 public education campaign increased vaccine uptake by delivering evidence based, market tested messages through trusted messengers to enhance audience engagement during the pandemic. And the aging and disability networks have been pivotal in increasing vaccination among older populations and people with disabilities. These vaccine initiatives I mentioned earlier, they provided almost 1 million COVID, flu, RSV, and other essential vaccines.
Wow. So, just understanding that this is a really important issue, could you share some prevention tips for caregivers and their loved ones regarding vaccinations?
Yes, vaccines are your best protection against severe disease from flu, COVID-19, and RSV. And even if you're at low risk of serious illness yourself, it's still important to get vaccinated because it is the best way to avoid transmitting the viruses to your loved ones who may be at very high risk. There are many ways to avoid respiratory illnesses this fall and winter. The more of these you do, the better. One is to open windows and use fans to improve ventilation and reduce virus level indoors. Gather outdoors whenever possible to also reduce the risk of exposure to respiratory viruses. Wear a mask when in public places, especially in crowds. Wash your hands frequently and use hand sanitizer. Avoid contact with people who are sick, and if you get infected yourself, stay at home and away from others, especially those who be at higher risk for severe disease. It's also important to get the updated COVID and flu shots. Immunity to both decreases over time. In addition, the viruses can change from year to year. The updated shots give you the best protection. Updated COVID-19 and flu shots are available now. If it's not, and it's not too late to get them for this year. So everyone aged 6 months and older should get this year's flu and COVID shots. An RSV vaccine can be taken at any time, but getting this vaccine in late summer or early fall helps protect you from RSV when it's most common in fall or winter. Everyone aged 75 and older or 60 and older with health conditions such as heart disease, lung disease, obesity, diabetes should get one dose of an RSV vaccine if they have not been vaccinated for RSV before. And even if you have had RSV, a vaccine is still needed because you can get sick again. And pregnant people should get an RSV vaccine between 32 and 36 weeks of pregnancy during fall and early winter to protect their baby after birth.
So, that is a really comprehensive list of tips, Carrie. Thank you so much for sharing. So, one thing I wanted to make sure to touch on is this, uh, are there any side effects that caregivers should be knowledgeable about and or help their loved ones be prepared for?
Sure, it's definitely a concern that we know caregivers have. And it's important to know that most people have mild side effects or no side effects after getting a COVID-19 vaccine. Serious reactions to vaccines can happen, but are rare. For every 1 million doses given, we see five or fewer people having a severe allergic reaction. Some people have been concerned about heart inflammation after COVID-19 vaccine, but the risk of heart inflammation is higher after getting COVID-19 than after getting the vaccine. So it's
Mhm.
important to get that vaccine. And the benefits of the vaccines do outweigh the risk of COVID-19's long-term health effects or long COVID, which is much more common than serious vaccine side effects.
Very well put. I'm so glad you said that the benefits outweigh the risk associated with the vaccinations is always an important point to drive home. So, and continuing on that thread a little bit more, so individuals living in a shared space. So we mentioned the long-term care facilities, aka nursing homes, are at higher risk of contracting respiratory infection. But how can caregivers who still have a prominent role in the lives of their loved ones still ensure their loved ones living in long-term care homes get vaccinated?
Absolutely. So one thing to consider is if you are a caregiver that has power of attorney, they can ask directly to have the individual in their care vaccinated. The other alternative is to talk directly to the everyday doctor in the facility about the vaccination plan for their loved ones. Most people have either mild side effects or no side effects at all after getting the vaccine. So that is something, as I mentioned earlier, to keep in mind too, as you might have concerns about your loved one living in a shared space or long-term care facility.
Great. So, this has been a lot of wonderful information, Carrie. I just want to thank you so much for taking the time. But before we wrap up, where can our audience go to learn more about the Risk Less, Do More campaign?
We definitely want to point people to the Risk Less, Do More website because, like you said, Marvell, I did share a lot of information today. So we want to make sure people know that they can visit risklessdomore.hhs.gov to learn more about respiratory viruses, your risk factors, disease prevention. You can also go to visit_cdc.gov / risk less do more, or go to vaccines.gov today to get started finding a vaccine. We also want to highlight that the US Aging organization has information related to vaccines for older adults and people with disabilities. So you can get fact sheets and other materials at usaging.org. And then also, I just wanted to mention again that both the Elder Care Locator and Dial, which is the Disability Access and Information Line, are also available to call or to access through our website, acl.gov, for information also specific for older adults and people with disabilities.
Wow, great. So a lot of good places to get good information to have everyone stay informed. So, Carrie, thank you so much for taking your time today. Everyone, as I said before, this is Kari Benson. She's the Deputy Assistant Secretary for Aging at the Administration for Community Living. And Carrie, have a great rest of the afternoon and day.
Thank you so much.